Welcome back. Your time right now is 12:16. ADHD is a disorder that makes it difficult for a person to pay attention, and many patients are prescribed medication to treat those symptoms, but are some cases overdiagnosed? Well, we're joined by Dr. Timothy Quinn. Dr. Quinn, can you tell us, are some cases overdiagnosed? Do we overdiagnose our kids?
Most definitely. And I want to talk about a patient came about 2 years ago with the aunt, had just relocated to live with the aunt, and the aunt wanted me to restart ADHD medication. I pleaded with the aunt. I said, let's get evaluated by a mental health specialist first to make sure. It turned out the child did not even have ADHD, but had anxiety, and also it was determined the child was being abused in the previous home. So not only were we able to keep the child from going back to the previous home where the abuse was occurring, keep the child in therapy, and the child did great in school.
That is awesome. So what could happen if a child is taking it and they don't need it?
Well, the child is being improperly medicated, and it could affect the child's ability to learn because the child, like we say, in that case, is not needed. So the most important thing is every child needs to be properly evaluated by a mental health specialist. Now, UMC has a wonderful program. I also use a local gentleman named Dr. Damian Thomas. But the most important thing for parents to understand is we don't want our children to just be blanketed with the diagnosis of ADHD. We want them to be properly evaluated, and that usually requires a mental health specialist that follows a very strict protocol.
Are there any symptoms specifically that you see that will make you kind of question if a child needs it? What are those symptoms?
Well, it's the children typically present, they have inability to pay attention in school. They're reported as being overactive, you know, just raising their hand, blurting out answers, interrupting the other children. They'll usually have problems with their grades, even with their personal relationships. But the most important thing is to encourage the parents to allow the children to be evaluated by a mental health specialist, not just a pediatrician or a family doctor, so they can be properly evaluated so that if the child does have another medical condition or a psychological condition, it could be diagnosed, and then that condition can be properly treated, and that child can get the fighting chance they deserve to reach their true potential.
And I'm pretty sure the same would be for adults too. Don't just jump the gun. You want to get somebody else to give you a second opinion, right?
Most definitely. I mean, ADHD in childhood is very prevalent. It's about 11% of the population, but it's also very prevalent in adults as well. These adults may have problems holding a job for a long period of time, may have marital problems, problems with their parenting. It's very important that if you have symptoms that suggest ADHD, you go ahead and be evaluated, but I emphasize by a mental health specialist.
And you said UMMC is a good place to go?
Oh yes, UMMC. Just basically you can check with your primary care physician and just, you know, encourage or allow them to refer you on to a mental health specialist, because a lot of people say, I don't need to see a psychologist, or my baby doesn't need to see a psychiatrist. But in the big picture, you want the child or the adult to be properly evaluated so the correct diagnosis can be reached, and that way the proper and the most effective treatment can be provided.
Thank you so much. And this adds into the importance of mental health. And mental health has become something that has become a bigger topic for people all around. So thank you so much.
Hey, thank you.
Thank you, Dr. Quinn, for being here with us.